Thanks so much everyone for joining. My name is Rachel Carey and I'm part of the Behaviour Change and Public Health team here in BUPA. And my colleague Juliet and I are going to do a bit of a double act for this first portion of the session this morning. Just by way of kind of background, the work that we do mainly focuses on applying behavioural science principles to the development, implementation and evaluation of a whole range of products and services. So we're really excited to have the chance to share some of that with you today. We're going to talk through some kind of broad behavioural science principles and also some kind of more specific examples that relate to digital. So it's going to be a little bit of a whistle-stop tour, but hopefully we'll have a chance to kind of give an overview of some of the resources and tools and processes that we use in behavioural science. So just in terms of structure, I'm going to start off with a kind of introduction to behavioural science in general, talk through some theory-based models and frameworks that we use. And then Juliet is going to talk a little bit about the application of specific behavioural science principles to digital products and services. So bringing it a bit more to life and giving some more kind of tangible, specific examples. So we're then going to have three short updates from three MUs. So Judith in ANZ is going to give an update first, followed by Emily on behalf of BUPA Global, and then Fiona on behalf of BUPA UK. So we'll hopefully leave plenty of time for questions and discussion at the end, but also I'm happy to take questions throughout. I've got the comment pane up, so feel free to jump in with any questions or clarifications or comments at any stage. All right, so just to start off with a little bit of context, I think in recent years, the terms behavioural science and behavioural insights and behaviour change and nudging have become much more commonly used. Principles from behavioural science are being applied now quite widely in health and healthcare, in technology, in advertising, in marketing and business. And we've seen this huge increase in kind of awareness of these concepts. They've kind of joined our everyday language. And that's a really good thing because it means that there's kind of greater awareness, but it also presents a couple of challenges. And one of these is that it's not always completely clear what we mean when we talk about behavioural science and behavioural insights. And the other challenge is that there's a risk of kind of oversimplification, that the more we talk about this stuff, the more we think we can do it kind of intuitively, when actually there's a kind of very broad and long-standing evidence base. So we're going to try and kind of synthesize some of that today. So just very briefly, behavioural science is the systematic study of human behaviour. It's a multidisciplinary field, so it applies insights from disciplines including psychology, economics, biology and neuroscience. And it examines a whole array of different factors that influence our behaviour, including biological, psychological and environmental and social factors. And I think this is important because behaviour change is not easy or straightforward, and it's kind of critical that we draw on insights from different fields to build a more thorough understanding of what influences our behaviour. So, for example, if someone is told by their doctor that they need to drastically reduce their cholesterol and they're given some examples of things that they can do to that end, so some guidelines on what not to eat and what to eat, and they leave the doctor's office feeling completely sure that they'll follow through and planning to and intending to, but then 2 days later something goes wrong and they fall back. We might make a whole lot of assumptions about why that's happened. We might assume maybe it's something in their environment, maybe it's something to do with their habits or their kind of willpower or motivation. But unless we kind of adopt a more scientific and systematic approach to understanding all of the different things that might be influencing that behaviour, we're kind of shooting in the dark. So it's really important that we draw on these evidence-based principles from behavioural science when we talk about behaviour and behaviour change. So, as I mentioned, behavioural science is increasingly being applied to digital And that's because behavioural science insights can be a really effective approach to both the development and evaluation of digital tools. So they can help us to create tools, products and services that are engaging and motivating and convincing. They can very effectively identify ways of tailoring and targeting for a specific audience. And they can help us to develop interventions that have a measurable, sustainable impact on behaviours relating to health, but also outside of health, so to things, organisational problems like customer and employee satisfaction and retention. So as we go about our daily lives, we are constantly being influenced by psychological principles that are embedded in technology, that are designed to alter the way we interact with them. So whether it's the things we click on, the things we buy, the things we share, and it's really important that we account for kind of behavioural tendencies when we're designing digital interventions. There's also lots of principles that you're probably already applying in digital that you know to be effective, but which you can see through a behavioural lens. So that's just a kind of bit of background on behavioural science in general, and also how it's being kind of increasingly applied in the field of digital. So I'm just going to talk through over the next few minutes in a little bit more detail the kind of steps that we go through in developing an understanding of behaviour in context. So the first slide that I've got here seems pretty obvious. It's looking to get a definition of behaviour. So we need to have a theoretical understanding of what behaviour is before we go about trying to change it. And it might seem straightforward, but there's actually lots of variation in how What I've got on screen here is an extract from a kind of multidisciplinary consensus definition of behaviour, which is very broadly anything a person does in response to internal or external events, which can be directly or indirectly measurable. So it can be something really simple like clicking on a link or pressing a button, or it can refer to a more complex sequence of behaviours like putting on sunscreen or brushing your teeth. These examples that I've given on screen are probably straightforward. I can't imagine anyone would doubt that these are behaviours. But when we talk about more sort of abstract concepts, it gets a little bit more complex. And the example that I wanted to give just briefly is digital engagement. So this is a term that we use quite widely, and it has been used in information science and computer science and psychology, behavioural science for a long time. But it's not always entirely clear what we mean when we talk about engagement. Olga Persky, who's a BUPA-funded PhD student based at University College London, has come up with a consensus kind of definition of digital engagement off the back of kind of decades of empirical research. And she's defined it as two things, both the extent of digital behaviour change intervention use, so things like the amount, depth, duration, frequency, and also a kind of more subjective experience that's characterised by interest and attention and feelings and thoughts. So you can measure this through a kind of self-report questionnaire to get some subjective measurement, but also by kind of more objective measurements to try and tap into this first point. But I think what's important here is that you can break this down into multiple sub-behaviours. So according to this definition, engagement is in itself a behaviour, which might differ from the kind of target behaviour you might be ultimately wanting to change, but it's a crucial part of the behaviour change process, because unless you engage with an intervention, it's very unlikely that anything's going to change. So the kind of broad point here is that the very first step with any of this stuff is to be really clear about whether the problem or issue you're tackling is a behavioural problem, and if so, what specific behaviours are involved. So if you're looking to change a behaviour, so if you've decided that the issue you're tackling is a behavioural issue and you need to kind of think through some of this, some of the influences, where do you go from there? So I think the instinct can often be to want to jump straight to a solution, straight to a strategy. And that's for good reason. Usually there's a kind of limited amount of resources and time. You need to have something to show for it. And you want to develop something that has a kind of tangible impact. So we often jump straight to a solution, straight to an intervention directly from a kind of general problem statement. but we're kind of skipping this key step, which is developing a thorough understanding of the behavior in the first place. So the diagram at the bottom of the screen here is kind of encapsulating an approach whereby the solution and strategy is reached very quickly and intuitively based on assumptions without having an understanding of what happens in the kind of black box in between. And this space in the middle is kind of what behavioural science is all about. It's helping us to develop a systematic understanding of a behaviour so that we can more effectively change it. So I'm going to spend the next couple of slides just unpicking this question mark box. And I want to present this in 4 steps. So this is about kind of narrowing it down from something very broad to something much more specific. So we start off with a broad statement of what is the behavioural challenge. So what are you trying to change? What problem do you want to address? Whether it's kind of increasing downloads of something, whether it's increasing visits, whether it's getting a kind of increase in acceptability of a particular technology. Have a very clear problem statement at the start. And then the next step is to break that down into sub-behaviours. So try to generate a long list of all of the behaviours that might be relevant to the problem that you're trying to address. And then the third step is to get more specific about what the target behaviour is. So we know that less is more in behavioural science. The more specific you can be, the more targeted you are, the better. So you want to try and focus in on one behaviour in the first instance and have a really clear and specific definition of what that behaviour is, rather than trying to change everything at once. And then the final step is to think through what kinds of factors influence the target behaviour. So what are the barriers? Why is this not happening? If you go back to the example of the guy who was trying to reduce his cholesterol, what impacted on that behaviour? Was it that it was his motivation? Was it that, you know, his environment didn't allow him to buy the right types of foods? It's about trying to think through a long list of all the factors that might be influencing it. So just to give a kind of example, pretty simple example, if your general problem is that there's high levels of stress in the workplace and it's your job to try and fix that, some of the behaviours you might think of that as being relevant might be things like you might be having a lack of sleep, staying up late, staying late at work, not taking a lunch break, working weekends, not switching your phone off in the evenings. And you might narrow that down and decide that actually the behaviour you think will have most impact to focus on is leaving the office every day for a walk at lunchtime. And so that's bringing it from a very broad behavioural problem statement down to one specific target behaviour to change. And at that point, once we have a specific statement, we can do what we call a behavioural diagnosis. And this is trying to understand the range of factors that are influencing that behaviour. So I'm going to talk a little bit more about that now. So this is the model that we tend to use for this behavioural diagnosis step. So this was developed by a team at University College London, and it's a kind of synthesised, integrated model of behaviour change that's kind of tried to synthesise lots of different theories over years of research. So it's designed to be usable and useful and simple. And it specifies 3 factors that influence behaviour. Capability, so whether you can do something, your knowledge, your skills, your ability. Motivation, whether you want to do something based on habits, feelings, desires, thoughts, attitudes, perceptions. And opportunity, so whether your environment facilitates it. So this can be your physical environment, whether you've got time, resources, money, also your social environment. So whether the culture facilitates it, whether you've got friends who do it, whether there's any kind of social support needed. And the premise is that once you have these 3 factors, the behavior can occur. But if one of these is missing, then that's where the problem lies, and that's where your focus should be in the intervention. So for example, if you think about something like you want to increase visits to a website, for example, capability factors might be things like remembering to do this, awareness of kind of what to do and how to do it, ability to prioritize it over other things. Motivational factors might be, are you in the habit of clicking on it? What are your attitudes? What are your emotions, etc.? How does it make you feel? For example, Facebook gets return users because it makes them feel good arguably sometimes, and it's about kind of more unconscious and conscious influences. And then opportunity is around maybe how easy is it to find, have you got friends who visit it, etc. So it's basically, it's not a revolutionary idea in terms of what it's presenting, it's just a way of structuring your thinking so that you're kind of bracketing the different factors into these three higher order categories. And the idea is that based on what's kind of missing, if you decide, okay, people know what to do and they want to do it, but it's just not easy to find, then you know you want to focus your efforts on opportunity. Whereas if you think that people actually, it's really easy to find and people want to do it, but they're not exactly sure what to do, then you might want to focus your efforts on capability. So it's just a way of getting more specific and being able to trace back why you're doing what you're doing and making sure that it's kind of off the back of something that's based in reality and not an assumption. So once you've developed a kind of understanding of the behavior and what's influencing it based on a model like COMBI or something else, I guess the question is sort of how you might want to do that in practice. So it works pretty well in theory, but what do you do if you've only got 2 days and you need to kind of get something together? So there's a whole range of things you can do, but the key point is to ask the right questions of the right people and not to make assumptions. So to identify what works best for a particular problem, for a particular population, you need to talk to potential users, examining reactions and thoughts, looking at the evidence base, research studies, consultation with stakeholders. So we have questionnaires informed by the COMBI model that can help guide an understanding of a particular behaviour. You can also do it in focus groups or interviews or even just with a meeting of kind of key people in a room, which we've done, which some of the MU updates will talk through. So it's kind of, you can apply it at any stage and to any extent. It doesn't have to be a kind of very long drawn out process, but I think the point is that anything is better than nothing in this context. So drawing on some of these principles means it's more likely to be effective and targeted and tailored. So what we do from there, once we have identified what needs to change in order for the behavior to occur, we can start thinking through what we might want to do about it. So what the solution looks like. So we've kind of unpicked that question mark box and we're ready to move on to thinking about a solution, a strategy, an intervention. And for this, we generally use a framework called the Behavior Change Wheel. So this is, again, a synthesis of other frameworks. So you might have heard of Mindspace or EAST, which Juliet is going to talk through. This is a synthesized framework that includes those previous frameworks. And you'll notice that the COMBI model is at the hub of the wheel in circular format. So the idea of this is that you work your way out. So you identify what needs to change in COMBI. For example, motivation needs to change. And then you can work your way to the outer layers of the wheel, which are kind of broadly intervention strategies. So just to give some examples, I'm not going to go through this in too much detail, but intervention strategies might be things like education, persuasion, incentivization, training, modeling, environmental restructuring, restrictions. So one example would be if you think that the key thing that needs to change is social support. So you need to think that people around you are going to approve of you doing something, that they also do it, that there's something to do with your social environment that needs to change. You might want to focus in on modeling. So this is a category that focuses on providing an example for people to aspire to or emulate. So using someone who looks like you and seems like you and is kind of part of the target population to give a message. But it's about being able to trace back the strategy to what the barriers were in the first place and not jumping kind of straight to a strategy. So it's about sort of opening up to all the possible options. Just to finish off this broad section by saying that the principles in behavioural science, including some of the frameworks that I've just talked through, can help in the development of a new solution or product or intervention, but also in evaluation. So you can use this stuff to retrospectively analyse what's in an existing product or service and whether it's fit for purpose and which parts should be kept and which parts should be built on and which parts should potentially be removed based on whether they're tackling the right problems. And it's also really important to be able to measure success. So unless you measure the outcome, you won't have reliable data about what did and what didn't work, and also how and why. And that means we can learn and we can improve and we can refine going forward. So it's really important that that's something that's kind of brought in at the beginning, and not a kind of tag-on piece at the end. So that was just a very brief overview of some of the frameworks and models that we use. I'm going to take maybe a few questions or comments now if there's anything that jumps out at this stage, and then I'll hand over to Juliet to try and bring some of this stuff to life with some more specific examples. Cool. So if there's not any questions at this stage, then I'm going to hand over to Juliet and we can take some questions at the end of the section.
Thank you, Rachel. That was a great broad overview into how we use behavioural science to change people's actions and for the better. So I'm going to talk you through some more kind of tangible examples of how this works. So drawing on the broad overview that Rachel gave us, I'm going to go through how those principles and frameworks are applied in practice. So to kick off, I've got an example from HSBC. So obviously they're a bank and their customers would ideally probably like to save more money and spend less money, which we would all like to, but it's something that we inherently struggle with. So they created this app called Nudge in partnership with LSC that uses these behavioural science principles, but also uses their customer data so that all of their messaging can be incredibly tailored to the audience. So this shows a kind of range of sort of tips and notifications that people received. Apologies for the quality of the image. We couldn't find anything more detailed. So the first example I want to show you is this one. So it says a saving tip. You typically have £250 available at the end of each month. Would you like to save a portion of that amount now? If yes, call this number. And that's really just about reducing friction and making it as easy as possible for people to save that money. So humans are inherently lazy, unfortunately, and if there are any kind of barriers or friction in our way, then we're much less likely to do something. So pointing out to people that they already have this money available and how easy it is to save a portion of it makes that behaviour much more likely. A second example is giving people a bit of an ego boost. So this one says, spending expert. In October, you cut your discretionary spending by £150. Why not consider investing this amount in your savings account? So it's giving people, you know, a reward, a bit of a compliment for doing that desired behaviour of spending less than they were before. And that can be a really powerful reinforcer of positive behaviour. And lastly, they've provided a social norm. So they've said, 80% of people in your age and income bracket save more than you did over the last 3 months. Have you thought about increasing your savings? Now, humans are herd animals. We like to do what people around us are doing. And knowing that you're saving less than the vast majority of your peers can actually be a much bigger motivator to change your behaviour than, for example, knowing the benefits of saving. So again, that's a really important behavioural science principle that's been applied here. So why is it that we struggle to save and spend more than we'd like to? Well, you can look at this from a kind of evolutionary perspective. So if you follow your spinal cord up to the base of your brain, that part is the oldest bit of the brain in terms of evolution. And we share that with all other mammals. And that's where we do lots of our unconscious thinking and controlling things like body temperature, and that's where our moods and emotions happen, and that's where we store memories, but we don't actually have conscious control over that part of the brain. And then moving up, we've got the frontal lobe on top of that, and that is the part that's unique to humans. So that's where we do our abstract reasoning, where we can do complex mathematics, and that's where we kind of consciously think. So that's when you hear you know, your own thoughts in your head. That's where that all happens. So this is important because these can be seen as kind of two systems of the brain, which we've characterized somewhat unfairly as Homer and Spock. So Homer is this automatic part of your brain that we share with animals that we don't have control of. So that's a very fast part of the brain. It responds to our environment very quickly. It's unconscious, it's emotional, it's effortless. So we don't have to put in any thought in that part of the brain because it just runs by itself. And then the second part is the reflective part of the brain. So this is our prefrontal cortex, and that's very slow. It's very effortful to make decisions and think using this part of the brain, and it's conscious and it's rational. So this goes back to the COE model that Rachel was talking about, and this is the motivation part. So we've got these two different motivations. We've got our automatic motivation that we have much less control over. So that's like our habits and our inherent biases. And then we also have this reflective part, which is much more our consciously held beliefs and attitudes. So to give you some examples, me presenting this in English is using my Homer brain because it's my native language. It's very easy for me. If I was trying to present to you in French or Spanish, you'd be seeing much more of my Mr. Spock brain. So that would be me hastily trying to Google translate things and work out what grammar should be where, and it would be a much more difficult process. Similarly, taking your daily commute, after you've done it a few times, it goes into your automatic brain. You don't have to think about it anymore. And then as soon as there's a tube strike or something happens and you have to take an unfamiliar route, then you have to start thinking much more about it. And also, home is the part of the brain, unsurprisingly, that desires cake and high-calorie foods, whereas we have to really think about it when we want to make a healthy change, and that's why it's so difficult. So we have to keep these two systems in mind when we're designing interventions, because a lot of our decisions, in fact, estimates range between about 90 and 95% of our decisions are made with Homer and kind of post-rationalized with our Spock brain. So we need to be really aware of what he's doing and what will appeal to him. So there are lots of different behavioural science frameworks that come into play. So on the left there, we've got Mindspace, which is a kind of compilation of 9 different principles of behavioural science. Similarly, we've got EAST, that diamond-shaped one in the middle that was created by the government's Behavioural Insights team. And we've got the DEFRA 4E model that's about energy-saving behaviours. So we've got a vast range of different frameworks that combine these principles in different ways. And as Rachel was saying, we've got the behaviour change wheel on the right there that combines all of these together. So that's why we tend to use that one, because it's a thin synthesis of them all. But we also use things like Mindspace and EAST because they're a sort of much simpler distillation of the different things that are going on in your kind of motivation side. So I'm going to take you through a few principles of Mindspace, just the beginning 5, so Mind S, and show you some examples of how these have been applied to create digital solutions. So the first one is messenger, and what this means is that we're heavily influenced by who communicates the information. And the credible source that the information comes from is shown to be one behaviour change technique that is consistently effective when we're looking at things like alcohol reduction campaigns. So a credible source can either be an expert, so an academic or a doctor or a specialist, but it can also be celebrities or just people that we find attractive. So it's quite interesting the way we perceive different people to be authorities on things that they may not necessarily be. So one example is looking at the recent Brexit vote. People like David Beckham were wheeled out in support of Remain. So he was seen as a good messenger for people to understand the complex political landscape of leaving the EU, which is quite interesting. And one study found that doctors were rated as more credible when their certificates were displayed on the wall and their advice was more likely to be followed. So it's very important when we're designing an intervention that the messenger is correctly matched with the message that we're trying to give, and any kind of cues of authority that we can provide are given. So we've got an example of toothpaste adverts on the right there. So you can see Shakira's advertising the beautiful whitening benefits of a toothpaste, whereas we've also got a very serious dentist in a white coat when you're talking more about sensitivity protection and the more scientific aspects of toothpaste. What does this look like in digital? So one campaign you may have seen was in collaboration with NHS and the dating app Tinder, that was to raise awareness about organ donation. So what people did is they would be swiping on their Tinder account, and then some celebrities would pop up. So this is with using celebrities like Jamie Lang from Made in Chelsea, not huge names, but still recognisable people. So you'd be swiping along on your Tinder account and you'd match with a celebrity, and then you would be given information about organ donation and signing up to a donor register, which used the quite kind of clever analogy of, you're looking for a dating match, but it's incredibly hard for a lot of people to find tissue matches when they need an organ. So that was a really powerful way of using, you know, a well-known celebrity messenger in order to raise awareness about something like organ donation. We've also got some websites that people tend to use for medical advice on the right. So NHS Choices gets around 12 million hits a week, which is incredible. And people go there because they understand that it's a credible source if they want information about their health. And same with things like WebMD and the Mayo Clinic and patient.info. These are well-known names, and they're given quite a lot of authority because people understand that there's evidence and experts, and they can trust the information that comes from these sources. So the next principle is incentives. So our responses to incentives are shaped by predictable mental shortcuts, such as strongly avoiding losses. And this is important because it differs from kind of classic economic theory that people will respond to prices in a very rational way. And there are many other incentives that actually might not adhere to those kind of theories, but are predictable and can be replicated across lots of different people. One of these is loss aversion. So we're more motivated to avoid loss than we are to pursue gain. And an intervention tested by CVS Pharmacy in the States had two different smoking cessation programs. And the first one asked people to put down a $150 deposit. And a year later, they would be able to have that back plus $650 if they successfully quit smoking. And the other condition, people would simply receive an $800 bonus if they successfully quit a year later without having to put any upfront money down. And what they found was that obviously the $800 was much more popular because no one really wants to spend £150 if they don't have to. But the people who had done the deposit condition were much more likely to be successful. So once we've got some skin in the game and we stand to lose something by not sticking to that behaviour, then we're much more likely to do it. Secondly, is framing. So the way information is framed can greatly influence the way we perceive it. So for example, studies have shown that people are much keener for a surgery if it's framed as a 90% chance of survival rather than a 10% chance of dying. Now obviously that's exactly the same information, but people perceive it very differently based on the way that it's framed. And lastly is present bias. So we tend to value rewards in the present much more than the same reward or an even bigger reward in the future. So we kind of discount things as time goes on. So probably the most relatable example of this is trying to lose weight. So you will have a choice between eating something delicious now or potentially being thin far in the future. And for a lot of people, that's quite a difficult struggle, and you'd rather have that delicious thing now. And the example we've got here is quite a famous example in the behavioural economics literature. That was The Economist and their subscription for their magazine. So they offered a digital subscription for $59, or a print subscription for $125, or a print and web subscription for $125 as well. So you look at that, and the print subscription is obviously kind of it's irrelevant, it's redundant because it's the same price as that plus web. And what you find is that having it laid out like this nudges much more people to the print and web subscription because it feels like a great deal than if you just remove the print subscription altogether. Much more people tend to go for the .com subscription by itself. So it's really interesting the way even choices that never get chosen can influence our behaviour to choose different things. So how this looks like in digital, this will be something that you'll have seen a lot of the time. And this is just a screen grab from booking.com, where they've used tons of nudges just to make you feel as stressed as possible while you're trying to get a hotel room. So you can see on the left there, this loft room has just been booked. It's in high demand, so you're kind of already a bit on edge wondering if you're going to be able to get this room. There's a time remaining column in the middle, so there's only 13 and a bit minutes left for you to get this low price. They also show the original price of £190 as well as today's deal of £114, and letting you know that that's a 40% saving. And there's also, they let you know on the right there that 19 people are looking at this room at the moment. So if this information was just presented as, here's a loft room, it's £114, would you like it or not? That's a very different proposition to knowing that there are 19 other people who are waiting to grab your hotel room. The Next principle is social norms. So we're strongly influenced by what others do, as I mentioned earlier. So knowing that other people are engaging in a behaviour reassures us that it's kind of a safe and normal thing to do, and also that we won't be ostracised for participating in it. So it's very important to us to fit in with the crowd. And one classic study in this is looking at the effects of different messages on towel reuse in hotel rooms. So they tried a kind of pro-environmental message that just said, please reuse our towels to save energy. And another one just said, please reuse your towels, 75% of guests in this hotel do. And what you find is that there's a 35% towel reuse rate when you look at the environmental message, but that jumps to 44% when you're told what other people around you are doing. Which is interesting because if you ask people why they behave the way that they do, the majority of people would say that they'd be much more motivated by the environmental message, because we like to think that we're doing things for good, virtuous causes, but actually we're much more motivated by fitting in with the crowd. But there can also be unintended consequences to using this kind of norm. So what you want to steer clear of is using a negative norm, which is something you see a lot when people are trying to shock and, raise awareness about something. They'll say, 95% of people are doing this terrible thing. Well, actually, that tends to reinforce it, and people are much more likely to do it in that case. So one study, a similar study about energy use, told people how much energy they were using on a monthly basis relative to their neighbours. And some people were told, well done, you're using much less than average. And these people then tended to increase the amount that they were using in order to be more in line with the norm. So what you have to do is kind of enhance good norms, but be quiet about bad norms so that people don't just automatically do that. So we've got a couple of examples here. One of them is from a PhD project that was developed at UCL, looking at how we can encourage people to drink less. And what this shows is how they demonstrated to people that they were drinking more than average. So you can see they've got two different visualizations of it. And people typically tend to underestimate how much they drink relative to the average population, and that makes them kind of feel better about it and feel like it's not a problem. But as soon as you tell someone, you drink more than 95% of other people, that becomes quite shocking, and it becomes a behaviour they want to change. So this has been something that's been found to be really effective. And the way it's been visualised as well is important, because people don't tend to understand statistics very well. So having it very visual is a huge help as well. And the other example is something that you will have seen kind of every day on the internet. So just customers who bought this item also bought. And that's just a way of saying, you're already interested in this. People like you also like to do these things. And people are much more likely to then add that to their cart because they perceive it to be what everybody else is doing. So the next one is default. So as I was saying, humans are quite lazy. We're cognitive misers, so we like to go with the flow of preset options and don't like to rock the boat too much if we don't have to. So we'd like to conserve our mental energy, our Spock energy, and let Homer just run with it. So one classic example of this is organ donation. So you see in countries where there's presumed consent, so you have to opt out if you don't want to be an organ donor, the rates of donation are much, much higher. They're 98, 99%, relative to countries like the UK, for example, where you have to opt in, actively make a decision to opt in if you want to be an organ donor. And the rates here are much lower, more like sort of 12, 15%. And that's not due to a difference in attitudes at all. So between the different types of country, people are all pro organ donation. It's just more a matter of people, making the effort to fill out that form and say they want to be an organ donor. So any way that we can reduce friction and make a process easier for people, so that could be pre-populating forms, only asking really necessary questions, and reducing the number of clicks it takes to get through something, will ensure that more people stick with it and don't just abandon. So some examples here. You have probably all heard the example of the $300 million button, but I'm going to go through it anyway. So this was about 10 years ago now. An American e-retailer added this one button to their checkout page that increased their incremental revenue by $300 million a year. And all that button was instead of having log in as an existing user or create a profile, they added the proceed to checkout as a guest button. which is now kind of widely adopted, but at the time it was quite revolutionary. So when you're faced with a choice between logging in and registering, they're both quite cognitively effortful tasks. So you've either got to remember what email address you used, what your password was, or you've got to enter lots of information up front. Whereas just proceeding as a guest is much easier. You can enter all your information anyway, but it's not an upfront, oh, I've got to do this task before I can then purchase my items. So something as simple as that can have a huge effect on what people do. Another example there is from the Times. So if you kind of get sucked in by their clickbait and see an article you want to read, they give you a few paragraphs, and then if you want to read more, you have to log in there and then. So it's a very easy way to kind of catch people when they're already interested, and it's very simple to just click through and decide that you want to be a Times subscriber because you want to, know what happened with the rest of that article. And one last example is salience. So our attention is drawn to what is novel and seems relevant to us. So we're confronted with a whole host of different stimuli in our day-to-day life, and our brain has to filter through all that and decide, what's interesting and what's relevant for us. And that's quite a difficult task. So one way that is helpful is using personalization. So that's a good way to grab our attention if we hear our name or feel like something's really relevant to the location that we're in or something like that, then it makes it much more likely that we're going to respond to it. And also if interventions can be delivered in a timely manner at the point of decision making. So if you're trying to give up smoking, it's going to be much more helpful to have a message that occurs when you're feeling an urge than when you're sort of in quite a neutral state and you're not feeling that way. So the example I've got here is a staircase in Singapore that's much more colourful and bright and just appealing than the escalator there on the left. So people are going to be much more likely to want to take those stairs and get on that boring grey escalator. A couple of examples here. One experiment was done by the government's Behavioural Insights team to look at how they could increase the numbers of people who are paying fines rather than having to send the bailiffs around. So they tested a few different methods of sending people text messages, and they found that personalising them was the most effective. So saying, Juliet Hodges, you have not paid your fine of £120.85, pay immediately or a warrant will be issued to the bailiffs, elicited a much stronger response. People were much more likely to just pay their bill without having to get the court involved than just a text message saying, you've not paid your fine, please pay. Also, that is a mocked up text. I have not received one of those from Her Majesty's courts. I made that for illustrative purposes. So, yes. And the second example there is it's an app that you can set your own push notifications for various things. So the example here is, hello, Mr. Smith, did you take your morning medicine today? So you can remind yourself, at the point when you need to be doing something, and it has your name. So it's very relevant and novel, and you're much more likely to notice that. So that's our whistle-stop introduction to behavioural science. I just like to sum up with this quote that I think kind of captures our whole approach. So, human nature is not a problem that can be fixed by rules and regulations. All solutions to the existing problems must be based on how people behave, not on how we think they should behave. So typically, you look at particularly public health interventions have been focused around kind of making it punishing to have people exercising more and eating better. But if we can make it easy for people, then it's much more likely to be successful. And understanding how the brain works is going to be really helpful in doing that. So feel free to ask any questions at this point. And also, if you want to email me or Rachel at any point, we've got our email addresses at the bottom there. So I'll just wait a minute or two and see if anyone has any questions, and then I'll hand over to Judith in Australia for an update on what they've been up to. All right. Okay. So Judith, do you want to take over? Should I stop presenting?
Yeah.
Yeah. Okay. Over to you, Judith.
Thanks. I hopefully will try to share my screen and everybody will be able to see it. So let's cross fingers. Share my desktop. So just while I'm waiting for that to load up, I just want to mention my name's Judith Nye. Oh, that didn't really work. There we go. Can everybody see those the slide deck on screen now?
Yeah, we can see that.
Oh, excellent, great. Okay, so my name's Judith Nye. I'm from the Health Content Solutions team. I have to send apologies from Audra Millis, who was going to do this presentation originally, but she is quite ill today, so she had to go home a little bit early, and she really wanted to come and speak to you. She was quite excited about this. So just do get in touch with us if you do want to hear more about any of the things I speak about today. We'd love to chat to you about this. So the Health Content Solutions team is part of the rebranded medical team. We're now called Health Experience in the Australia and New Zealand MU. We have a team of 7 or so who are responsible for shaping great health content experiences across the MU. We have a really varied amount of backgrounds in us with public health, health practitioners, communications, psychology. And so that's really fed into, we all have a fairly keen interest in digital technologies and sort of customer user experience as well. That's kind of really come together for the team to be able to do some of the work that I'll introduce today. So I'm actually going to go back in time a little bit. I know originally we were thinking of a 2016 review, but I'd like to start with something that we started doing in 2011. So just one of the first things, I think Rachel and Juliet have already touched on this, but one of the things we've discovered along this journey as we've looked at digital health solutions is that oftentimes if you just ask the customer what they want, it's good to meet that, but what we found is that sometimes there's a lot of needs that aren't explored because it really takes looking at their behavior to get an idea of actually what were they trying to get at, apart from what they can express as a need or a want. So we really look at, what does the customer want to do? That's always central, but we also look at, the behavioural things that we need to look at, whether that's motivation, opportunity, or their capability. And then we look at, also what do we as health practitioners or as a health and care company want to reach as a health outcome, and we kind of try to bring them all together in a solution that might help people get there. So one of the first challenges we faced more than 5 years ago was kind of posed a question, which is how might we help everyday Australians eat basically healthier packaged foods, because we know that people are going to go to the supermarket and buy packaged foods. It's okay to run around and tell people that they have to eat, whole, fresh foods. But in this day and age, this kind of people are expecting convenience that they want out of their grocery shopping. So knowing that, how can we help Australians eat less salt, added sugar, saturated fats, and maybe less energy if that's causing part of a obesity problem? And then how do we help them to make those choices? So the problem was that currently we know that diet is a big factor in quite a few chronic and significant health problems. But also in Australia, our mandatory nutritional information is a panel of numbers and statistics. People find it hard to find, it's small, so people find it difficult to read, and then even when they found it and they can read it, they might find it difficult to interpret what it means for them and to actually lead them to make healthier choices. So one of the things, this is the approach that we've taken with all our digital tools, which is we start with insight. It's the idea of taking both, what is it's the behavioural science stuff that Rachel and Juliet just spoke to. We also add to that, the literature review, looking at what's already out there in the research. We talk with health professionals and researchers in these areas. We identify the drivers and barriers. If we can, we would go and speak to customers, have focus groups, and do customer insights testing. Though in this case, because this was quite early on, we didn't quite get to the customers at this stage. But we did look a lot into the research to try to identify, and also because luckily, I guess, most of us working age adults have to do grocery shopping at one point in our time or another. So a lot of us could use our own experiences as customers to bring their insights to this as well. And then we go into design. We think about, what is the behavior we want to target? What's the easiest thing? What's the most convenient thing? What do people want, immediately to be able to help change that, make that behavior change? And also we always test. So We tend to, we do testing before we launch. We often go out with an MVP. So in this case, we went out with one filter, so it only looked at just healthier choices in overall. And we also only provided it in traffic light labeling, which I'll explain in a moment. Then we have feedback, user feedback channels. We also do more testing, and as we sort of build and develop new things, additional features, we'll go back to customers, get their view on it, and before we go back out to launch again with those. So this is part of how we sort of diagnose the challenge that we were really aiming for. Like we said, we were helping people to understand the nutritional value of packaged food products, and then that would help them to make healthier choices. Generally, we're looking at people who shop for the household, often a parent, and the stopping thing was just fairly like, how can you simply buy a packaged food in a particular category that might have less of it, not so great nutrients, or not in quantity. A lot of the time people said to us, oh, but it's hard to do when you're in the supermarket already. I don't have time to look at every single label. I don't have the information at hand. I have like a child hanging off me, and that's going to, make it hard for me to spend time picking. It's just easiest to go for the default, whatever brand we've always picked, let's just put it in the basket. Also, if there's like a lot of brand choice, if you're only going there for the first time, again, you might just pick the one that you've seen the advertising for, or the one that has misleading food labels. So we love talking about here, often like a lot of low-fat yogurts will say, we're low-fat. And then you kind of, if you really scan them or look at their nutritional panels, you realize they've just replaced a lot of the fat with sugar to make it palatable. So it's not healthier as a choice, but the words, the labels the manufacturers have put on them can mislead consumers into thinking that that is a healthier choice. So these are just a few more things. And we thought about, we really want something that's quick and easy for people. And this time we could see the rise of smartphones with internet connections. So we knew that most people had those with them to be able to use in the supermarket aisle. And they just want something that gives them a nudge into the right direction. Not necessarily that they wanted to change all their eating behaviors in one go, but just, at the point of sale, what's one thing I can do now for a healthier choice? So we were looking at, this still says Mum Matters, but this is the food switch actually, sorry. So we looked at, whether or not it was a capability building that we were looking at, the motivation we were looking at, or the opportunity. And from most of our insights, we knew that we were really focusing on opportunity, that idea of something quick and simple now, and also capability, because it was people tended to want to do it. They wanted to choose healthier foods, but they didn't know how to, and they wanted to do it easily. So that's where we went and developed Food Switch. So we worked with the George Institute, which is a global health research institution, and we just used visual cues. As I said, originally we used this traffic light labeling system where you could see at a glance, if something was high in a certain nutrient. And then we also gave at the bottom healthier choices in that category that they could switch to. And that healthier choice is actually done on an overall basis, not just purely on those nutrients shown. So the idea was that people could just at a glance go, okay, there's a lot of reds here, I don't want this. Is there something in the list below that is, got more greens? And if that's there, then I can pick it, and that'll be a healthier choice that I've made right where I'm standing in the supermarket aisle. Yeah, so that's just an explanation a little bit more about the app. So as I said, we started off with an MVP in January 2012. And over the years, we've added a couple of different things. So there is a website that people can use online on their mobile for people who don't have an Android or an Apple iOS product. The database is continually updated and managed by the researchers at the George Institute, because that was one of the original things they came to us with, that they had this database, but they didn't know how to get the information in an engaging manner to the customers. We've also expanded so that we don't just provide the traffic light system, but we also use a health star rating, which is what the Australian government has asked food manufacturers in Australia to voluntarily put on their food packaging. We also continue with the healthier alternatives. We do the gluten one. We found that, so we have 6 different filters now instead of just the overall health one. We have salt, sugar, fat, energy, and gluten switch as well. And we found that gluten switch is one of the most popular because a lot of people who have gluten intolerance or celiac disease really struggle to find foods, and particularly healthier foods, because a lot of times if they found something that was gluten-free, they were quite happy that it existed already. But now we're saying you not only have to can find something that's gluten-free, but we can also help you find a healthier version of that gluten-free food. And the last thing is that it's been 5 years. The database in the meantime has actually grown and shrunk and grown and shrunk again, because what we have as a feature is the ability to crowdsource updates to the database. If someone scans the barcode of a product that doesn't exist in the database currently, or if they've noticed that some information is not up to date, they can just send in photographs that are captured immediately in the app and sent straight up to the database managers to validate and add to the database. So I'll just show you. So this is some of the statistics in the 5 years that we've launched. We still have an average of 12,000 unique users each month. We know that 80% of those sessions are from people who have previously used the app. It's been downloaded nearly 700,000 times in Australia across, to the end of last year. And that's quite a significant amount, especially since we don't do a lot of ongoing promotion of the app. Occasionally, like last year, we did a brand campaign that featured a user story, a customer, a Bupa customer who had a good experience using Food Switch. But in general, we don't do much shouting from the rooftops about our app, and people are still finding it, still using it, still responding to us about it. And in terms of whether or not we have seen behaviour change with Food Switch, these are actual real comments from customers. I manage the mailing address that comes in, and we still get several emails a week, whether it's people just wanting to tell us about their experiences or suggesting improvements. So you can see from here, we've got clinicians recommending it to their patients. We've got teachers adding it to their curriculum. We've got one of our favourite ones is the comment in at the bottom, right-hand bottom, which is Sandra. So part of the thing we said was that people found it difficult to necessarily scan labels and pick healthier choices when their kids were with them, and it was a bit chaotic when they're shopping. But we've actually had a lot of feedback that people say their kids really enjoy using Food Switch and seeing the traffic light colours come up, and that kids will actually, on seeing, some food being all reds, they're quite happy to either not buy the food or are happy to swap to something that's got less reds. And we've had lots of comments about people just scanning their entire pantry at home just for fun. So we do hear a lot of feedback from people that tells us that there's some change happening. The other interesting behaviour change is not from consumer side, but the Research Institute has also had a lot of contact with food manufacturers, in particular the 2 major supermarket chains here in Australia. They both have home brands in their aisles, and they both approached the George and said, we want our home brand items to get to the top of the healthier choices list. So how do we do that? What can we pay you? And the Research Institute said, that's not how it works. If you want to get to the top of the list, you need to reformulate with less salt or less added sugar or less saturated fat and make it healthier overall. And so they actually consulted in order to do that for quite a lot of their home brands in order to try to get to the top of the list. So we can see that as positive change as well. And there is research in this. If people are interested, I can send through links to papers or the actual papers themselves, where George are doing ongoing research on the composition of certain food items over time. And they, for example, they saw that, from the time we launched Food Switch to now, there's been an industry-wide drop in the levels of salt in certain brands of ready-made meals, which are a common choice for people here. So there's some good science behind that as well. So before I move on to our other case study, does anybody have any questions about Food Switch?
Judith, I'm just wondering whether, just to try and make sure we've got plenty of time at the end for discussion,
Yep.
I'm not sure whether we should try and have the other two MU updates just so that we've got plenty of time at the end. We had kind of, yeah, I don't know, or maybe do you want to kind of take another couple minutes and just briefly run through the next section and then we can move on to BG?
Totally, I can actually do the next bit a little bit faster. Okay, so next one is just how we face the challenge of perinatal depression. So this is something that we've been working on for the last 2 years. The big thing we found was that some Bupa Health Foundation research found that women in Australia, particularly in the private sector, were less likely to be screened for depression during pregnancy, and obviously that was affecting, the numbers of women who may experience postnatal depression and may require treatment. And so we wanted to drive health-seeking behaviours, basically, and we were able to do a lot more work in the insight and design buckets here, which was great. And so in May last year, we soft launched with an MVP, and then in November, after a couple of rounds of user feedback and modifications, we went with a full launch and a campaign. I won't go through this in detail, but this is how, again, we diagnosed the behavioural challenge and focused in on the idea of increasing health-seeking behaviours. And again, we did this with a focus on the COMBI model, and here we were looking at, I think, opportunity and motivation. We didn't focus as much on the capability, so we didn't necessarily give as much health information. We were happy to refer on to other resources that cover that area quite well, but the tool itself doesn't contain a whole lot of health information around perinatal depression. But we were more focused on helping people with their motivation for why they might want to do this health-seeking behaviour, and the opportunities and the sort of the encouragement and the enablement to do so. And so this is just some KPIs that we had. And so we worked with a hospital that specialises in postnatal depression, and we also worked with the University of New South Wales, set up a research program, and part of that was developing an online screening tool, free and easily accessible for women, in order to help drive help-seeking behaviour, and the university and St John of God are currently running a research program to evaluate how successful we are at using this. There are the links if people are interested in finding out and actually accessing the tools themselves. Obviously, the resources are all Australian-based, but the screening tool is obviously something that can be used across different areas. And so this is just to date. So as I said, we launched in November 2016. So we have had about 1,600 women uptake, and 93% of those people actually finished the first set of questionnaires and moved into the tool. And we have about just under a third of people consenting to participate in the research program, which has just started. Just a couple of quick stats. This is the last slide, I promise. So here are some comments from women who have used the tool, that it has already started shifting them from just thinking about their own physical health or the health of their baby, and thinking about themselves as well in order to benefit themselves and their baby. Most women are willing to use the app again, which is great because it kind of works on the idea of recurrent check-ins every 4 to 6 weeks. And most of them would be quite happy to recommend it on to other friends and family who would be pregnant. And so just 2017, we will continue working on Mom Matters. As Rachel and Juliet mentioned before, we need to be able to measure in order to work out what we need to fix and keep updating the tool to make sure it's engaging and does what it sets out to do. And we're also working on a separate wellbeing project called Project Dot that we're happy to go into that in a different session. Thanks. Sorry, I'm just going to stop there now.
Thanks so much, Judith. So we can pause for a couple of minutes for questions on that, and I'm going to recall up the slides, and Emily is going to present from this laptop in a couple of minutes. So let's... Just re-uploading. Just a quick recap. Okay. So you can switch on the video too if you like.
Okay. Hi everyone. I'm going to talk about a journey that starts in 2016. Well, this journey started in 2011. This is a lot earlier on in the journey. And it's the On Our Way Challenge. The reason I'm going to talk about it is because Bupa Global had amazing results last year and they won the Breakthrough Award for their challenge. And the reason they got so much engagement is because they included some behavioural principles, but not just because of the results. I'm going to share this with you because there are some exciting things happening this year with Australia and New Zealand participating, Bupa Global doing the challenge again, bigger and better. And not only Bupa, but we have 6 other organizations around the world across 4 different industries who are doing this challenge. We're going to go to the next slide. What I'm going to do is I'm going to share with you an overview of what the challenge is. I'm going to share with you as well the results, and then I'm going to share with you some tips and ideas from Bupa Global in terms of what they did and they think made a big difference, and then I'll share with you the next steps. So the On Our Way Challenge is a health and well-being initiative to engage people across different locations to move more, but not just move more, to have fun and enjoy working and connecting with our colleagues. The objectives for Bupa Global were threefold. The first one, because it was led by the SMILE group and the health and well-being lead, Laura Estelle in Bupa Global, it was about being healthier. But the second objective was connecting with colleagues across their 25 global locations. It's not easy, and especially last year, Bupa Global went through restructuring, so it was another reason to help people connect through these difficult times for them. And the third objective was to increase the ENPS score. In April 2016, it was -2, so they were keen to bring it back up through lots of different initiatives for the end of the year. And their approach was to partner with a corporate wellness platform. This is because Bupa Global felt they didn't have the expertise to do the challenge by themselves, so they partner with a company that can provide not only a visual representation of the challenge, but a technology that works across their 25 global locations. And that's something which we know it's quite difficult to get the approvals from all the different countries when you have a technology, and Core Health had already those approvals that allowed us to go ahead with the challenge. The technology, however, while it was a foundation for the challenge, it actually wasn't a thing that made it work. It was incorporating the behavioral change principles in a very comprehensive engagement plan. On average, Core Health sees about 30% engagement in their challenges. Bupa Global actually saw 60% engagement, so double what we would have expected. They launched it during Bupa Week. In May, they had 1,800 eligible users. By the end of the 3rd week, they had 44% users still active. While it's a dip, it's still more than what you would expect for an average challenge. 96% of users who completed the survey said that they wanted the challenge to take place again, which is why Bupa Global is doing it again in May for Bupa Week, starting Bupa Week, but it's going to last 4 weeks. And 92% of users said they would intend to continue their healthier lifestyle changes after the challenge, and the ENPS score improved to plus 37 in October. It's not just due to the challenge, but in the qualitative feedback, it was something that was mentioned quite often. So those are the results from Bupa Global. And what they did, if I go on to the next slide, is they used the MindSpace tool, not as a formula, because the key takeaway here is that there's no formula. You have to have a bit of planning, but also a bit of improvisation, and I'll give you some of the insights from Bupa Global here. Laura, she attended one of the training sessions that Juliet did last year on behavioral change, and they used the MindSpace tool to improve utilization of the employee assistance program. So when they came to the On Our Way challenge, they applied the same principles and the learnings to ensure that had as much success as they could have. And I'm going to pick on the messenger, because when I asked Laura and Ellie in communications, who developed this for Bupa Global, they said the biggest thing that made a difference was getting the leaders involved. And getting the leaders involved is not just an email to leaders, can you send this to your people? They made videos of the leaders, so it's actually the leaders to explain what the challenge was and what it meant. At each milestone, they had surprise videos of the leaders as well. And they emailed every week the leaders with a leaderboard for all of their teams. And what happened is there was competition between the leaders across the different locations, and that encouraged them to get their people involved. We had also the leaders do floor walks and encourage people to sign up. So not only did it increase sign-up rate, but it also increased the leaders' visibility and connection with their own people on the floor. By messenger, they stressed that it's not just the leaders, but it's also the peers being able to relate to the people who are leading the challenge. And Laura and Ellie did an amazing job at empowering each of the champions locally to organize their own events and encourage people to blog and send photos. And all of that meant that it wasn't just the leaders, but everybody felt that they were leading the challenge. The other key takeaway from Bupa Global is incentives. Incentives is not just about a prize, and it's not just about a prize for the top leader. They said the key here was that they improvised. Yes, they had a plan for incentives, but they had a budget, a surprise budget, to see where people where amazing stories happened or amazing photos were sent in, and they would surprise people and recognize them and give them a small prize. There was charity donations, there was prize draws, there was individual vouchers. So there was lots of varied different incentives. So even people who were not motivated by a prize or a voucher, there was still something in it for them. In terms of, I also asked them what they would do differently this year to try and get the lessons, and they told me they would engage the leaders earlier to get, and because they only give the leaders a week and a half notice, so they're wondering, not only did it make a difference, but they're wondering if they give the leaders more time, what else could they have done? And could they have got 100% sign-up rate instead of 60%? Another thing they would do differently is think long-term, because they thought, oh, let's just do 3 weeks of this challenge. But they realized that they should have thought more long-term, and can they design a initiative that thinks maybe 6 months? How do you, yes, people said they would intend to continue the lifestyle changes, but how do we know? Could we have done something? Maybe could we have had incentives three weeks after the end of the challenge, or to recognize people? So their advice was to think more long-term. And as well, the second advice was to think broader, because initially they thought, oh, this is all about health and well-being. But after speaking to people and speaking to HR, they realized, well, actually, no, the behavior we want to change is not just people walking more, because for some people that may not be relevant. For some people, it may be connecting with their colleagues on the floor. For some people, they may be less able, so it's not about reaching 10,000 steps a day, but it may just be 3,000 steps a day, and for them, that's a huge achievement. So we should celebrate as well those kinds of achievements. The next slide is talking about what happens next. And this is the really exciting bit, because while Bupa Global won the Breakthrough Award last year, we need to build on this success. And the questions are, can we improve it? Can we replicate this success? Was it just a one-off fluke when we had an amazing success and because it was novel, but if we were to do it again, will we still get as much engagement? And the third question is, can we commercialize it? So this year we are testing all of those questions. So the first thing we're doing in March, starting the 27th of March, and it's going on for 4 weeks instead of 3 weeks this time. We have 7 different organizations taking part in the On Our Way Challenge. We have independents in the US who are also in health insurer. We have the Abroad Group who are all around the world, and they're champions based in New York, but they're all around the world. They're a finance company. We've got 2 mining companies, one in South Africa and one, well, they're around the world, but it's their London office who's going to be participating, and that's Anglo American and Simone. And then we have EMIS Group in the US also participating, Emirates, and we in Dubai, and we have Bupa Australia, New Zealand. Bupa Australia, New Zealand, it's all of New Zealand taking part on the 27th of March, so that's about, we're expecting about 4,000 people. And then Australia, it's all our IS&T team, about 400 to 500 people, and all of our dental team as well, so it's about 2,000 people. So we're going from 1,800 eligible users to almost over 6,000 users. So it's going to be we were testing the sustainability and able to launch across a lot more people and able to reply to the queries and all the technical issues as well that comes with it. And we're also testing the process of encouraging and influencing other organizations to also take part in such initiative. We have less control over these companies, and they also have their own cultures and their own restrictions. So we've been learning a lot through them. And what we've done with these companies, if we've had champion calls where there's knowledge sharing that happens, and we've shared with them what our ideas, but what's happened is each company's taken that away and developed it into their own. So by the end of this challenge, come May, we'll have a lot of lessons from the different companies and how they took one idea and made it their own and adapted it to their own working force. And that's it for the On Our Way challenge. Are there any questions? No. So I'll pass over to Fiona.
Hey, Rachel, this is Brando.
Hi, Brando.
In terms of if we were able to say on a scale of 1 to 10, with where you think we should be as an organization as it pertains to behavioral science being deployed, I want to say within the digital space, for lack of better terms, but within the digital space, from a consumer-facing perspective, but also from an employee-facing perspective, in terms of engagement, some of the terms you used earlier around engagement and intervention. On a scale of 1 to 10, like, how would you say, like, how far do you think we are within that scale, and how well do you think we're doing on that, if you were able to kind of grade us?
I can only provide a number for the On Our Way challenge. We are at an early stage. It was only piloted last year, so we're really early on, and there's so much improvement. I know we can get really excited about the results, but looking at this and wanting to take away the lessons, there's so much more we can do. And for example, the post-challenge survey, for example, Bupa Global didn't actually check how many people responded, and then there was 44% people who were still active at the end. So what happened to those who dropped off? And that's what we really want to get to this year. So if I were to give a number, I would say 4. Despite the amazing results, I think there's so much more we need to learn.
Right. Okay, that's useful. Thanks. We haven't had a lot of questions today toward the end now. I think it's because you guys have done such an amazing job. Honestly. Yeah, the presentations have been fantastic. I've been learning so much throughout this session. I have another question for you guys, and it's really just to kind of ask Rachel, like if there was something that you could say to us that was really important in relation to behavioral science and adopting that and deploying that across digital, what would it be? Like if there was, just a point that you wanted to give us to keep at the forefront of our minds, would you be able to share anything with us in that respect?
I think my point would be to not jump too quickly to a solution and spend more time thinking about the problem and the behaviours. I think in digital, but also in general, we tend to want to jump too quickly to interventions and solutions, and I think it's about spending time at the earlier stages of understanding what's really going on. That would be my point.
Definitely. And I think that digital's moving in that way to an extent, in that we're doing things in a sort of test and learn approach, but understanding behaviours rather than just user needs, because user needs are perhaps not quite as in-depth and don't take into account behaviours as in what people do, not what people think they should do or what their attitudes are. And I think that's what behavioural science can bring to digital.
Should we put on the camera?
No, I'm fine without the camera. Yeah. Hi everyone, I'm Fiona. I am part of the other half of the public health and behaviour change team. So alongside Rachel and Juliet, myself and my colleague Sarah provide public health expertise to our team. Our team's fairly new to Bupa. Last year we sat within the centre wellbeing function, and since February our home has been in the medical team in the UK, so that we can work closer to the customer and we can demonstrate some real case studies for public health and behaviour change at Bupa. So that kind of, I feel that kind of answers your sort of first question there as well, Brando, about where behavioural science is with digital at Bupa. And I think it's in the early days, but I think there's a lot of potential there. And so what we're doing is we're building knowledge and capability around behavioural science. And then our focus for this year is around those case studies, so really showing what value it can bring to Bupa as an organisation. So I'm just going to talk through a couple of different areas that we've taken a behavioural change approach to in 2016, and then I'll talk about a couple of things that are on the horizon for us for this year. So the first one, let me click through. The first one is performance energy. So the people team approached us for help to develop an addition to the performance energy program, with the aim to embedding and sustaining performance energy learning and specifically non-negotiables beyond the training itself. So what we did is collected data from focus groups with performance energy coaches and survey data from people around questions like what their non-negotiable is, whether they've continued to do their non-negotiable since the training, and if not, what are the barriers to doing the non-negotiable. What we found were the main pitfalls for people were that they chose too many non-negotiables and they set themselves up for failure, and people weren't specific about their non-negotiable, what exactly it was, when they do it, with whom and for how long. And people often didn't plan for unforeseen circumstances. So what we did is we developed tips based on behaviour change theory and techniques, and we developed a worksheet in which people could do a mini behavioural diagnosis themselves to break down the behaviour, reflect on their motivations, and conduct their own contingency if-then planning. Over the last year as well, we've looked at a number of digital tools and reviewed how they work or how they could be optimised from a public health and behaviour change perspective.
Specific to Hearts at Work is the Bupa Heart Age Calculator. The purpose of the review was to assess the Bupa Heart Age Calculator in its current format and compare it to other products in the market against the criteria of engagement, behaviour change and health impact. We did this through triangulating published data from peer-reviewed journals with data from our own heart age calculator, and also using behavioural science approach to review the customer journey, user experience and the content on the site. So the things that we found from this was that the Bupa Heart Age Calculator is one among many available to customers. Bupa customers may interact with similar products that are integrated within existing health risk assessments, such as Sisu Wellness in the UK, or through a number of other providers, such as the NHS in the UK. Customers found the site engaging, evidenced by the low proportion who abandoned the site after arriving at the landing page. Like other heart age calculators in the market, the Bupa calculator tended to be slightly more appealing to men and those from younger demographics. The site receives almost half its visitors organically, with limited promotion for market units outside World Heart Day. And currently the calculator is not integrated into other Bupa tools and doesn't point the customer towards other Bupa services or content. The absence of the tailored content and the lack of alignment between user responses and health recommendations, we found that undermined the credibility and some of the clinical value of the tool. But ultimately, we found that the tool could be enhanced significantly and its long-term credibility assured by addressing some of those gaps. Now, the next one's around Health Tab, which Rachel's actually just going to talk you through.
So HealthTap is one of the companies that Bupa visited during the Silicon Valley trip last year, and it provides a health operating system, website and mobile apps that enable patient and doctor interactions and kind of link the continuum of care. So there's a strategic partnership between Bupa and HealthTap, which means that Bupa has the opportunity to trial the HealthTap technology across Bupa. So I've been working with the HealthTap team to, I guess, try to identify what some of the barriers might be for providers, clinicians, but also for customers in using a digital platform like this. So in practice, that's meant going back to some of the empirical literature, so the peer-reviewed intervention research, and pulling out some of the findings from those studies, and also talking to the HealthTap team who've been engaging with clinicians and trying to explore what some of those barriers might be. So we've done a kind of behavioural diagnosis using the COMBI model to try to explore what the barriers might be and how those can be targeted. So, for example, under capability, we looked at things for providers like, will they know exactly what to do and how to use it? Will there be any computer literacy issues? Under motivation, we looked at things like, what are people's kind of perceptions of data security and reliability? And then under opportunity, we looked at things like peer support. So will there be an issue that there's a lack of peer support, peer-to-peer support for doctors, for example, by engaging in a digital platform, and also accessibility issues around the internet. So I think what it's allowed us to do is to develop a kind of more targeted plan in terms of the training and in terms of the comms, so that we know the kinds of messages that are going to be sent out are tailored to the types of barriers that are actually there, as opposed to what the kind of assumptions might be. So, for example, it might be that it's more to do with kind of reducing perceptions of worries about data security, as opposed to increasing knowledge about how to use the app, because the kind of research is seeming to suggest that it's the former that's most relevant. So that's kind of a work in progress, but I think it's a really exciting opportunity to apply this methodology to something that's kind of about to be piloted.
Thank you. So, as I mentioned, our team's just moved into the UKMU, so there's many new things on the horizon for us. The one that we're continuing from centre is to engage with and develop skills of our workforce to be able to use behaviour change as a differentiated approach to solving business problems. This is through a Bupa-wide offer as an e-learn, which provides an introduction to behaviour change. And also we host more detailed workshops that give people applied skills to be able to use directly in their roles. And the next set of workshops that we're running are in Australia at the end of this month. We also have 2 time zone based communities of practice, one based sort of London time and one ANZ time, where those who have taken part in the workshops can keep up to date with behavioural science and learn from and share with each other. A couple of other things in train for us is continuing to develop our partnership with University College London's Centre for Behaviour Change, which includes sort of seminars, research and shared learning. With our own people, we're working alongside health and safety, for example, around driving behaviours, and care services around care worker engagement with benefits. And then lastly, we're working closely with our corporate customers through the UK PMI business to use public health and behaviour change expertise so that we can optimise experiences, engagement, products and services through insights, data integration and interpretation, population segmentation, and of course understanding the behaviours that underlie customer problems. Great, that's me. Was there any questions? No? Okay, I'll hand back to Rachel.
All right, so that's the kind of that's the lot for today in terms of content. I guess I'd be really interested to hear what people's thoughts are generally in terms of the some of the broad principles and also the specific examples that have been presented. Anything coming out as relevant or not relevant, or particularly helpful or particularly not helpful, or general comments and questions.
This is Emily here from the UK, and I presented the RNOA challenge. Listening to the presentation at the beginning, I found the behavior change wheel really useful. And working with Bupa Global and ANZ, I know that we haven't come across it and we haven't thought about it. And we just used the Mindspace tool, but we didn't actually link it back to the factors we were trying to impact and link it to the right intervention. So that may be something that next year, when Bupa Global launch it in May, they think about.
Is it worth talking about, obviously we've talked through the process of understanding a behaviour, breaking it down into target behaviours, doing our behavioural diagnosis, and then looking at how that maps onto the wheel. Often in that process, the next step is thinking about mode of delivery, and that's something where digital comes in, and the fact that that's probably potentially one of the last steps that you go through. Maybe an opportunity to talk a little bit about how you normally select mode of delivery, because in some cases we can pick digital by default, or in other cases we know that what we have to do has to be scalable, and I guess that's where digital in the first instance is going to be the mode of delivery rather than going through that process first.
Yeah, so this is a piece of work that I've been involved in at University College London. So I work as a kind of link person between UCL and Bupa. And one of the pieces of work that I was involved in at UCL over the last couple of years has been to develop a kind of framework for modes of delivery of behaviour change interventions. So there's been a lot of progress in behavioural science in recent years in terms of developing better understanding of the content in terms of the kind of techniques and active ingredients of behaviour change interventions. We're getting a lot better at describing them more clearly and also understanding which ones work best. Where we haven't made quite so much progress is in understanding what the best mode of delivery is i.e. What method we use to deliver particular behaviour change interventions. So whether that's by a person face-to-face, whether it's by digital means, email, text, website, app, whether it's through kind of a hard material like a poster or a leaflet or a booklet. And that's something that's kind of been a big challenge in behavioural science, is that we might have the best intervention in the world, but if it's delivered in a way that isn't the right method for our target population, then we're kind of, we're falling at the first hurdle. So what I can do is, if people are interested, I'm happy to share that kind of work in progress at UCL, which is basically around trying to develop a framework for modes of delivery. We haven't got so far as to identify specific types of modes of delivery that are best for specific types of interventions, but we are getting there, and there is some evidence for that. There's also a paper that was published a couple of years ago on specifically on modes of delivery for digital interventions. So that's another thing that might be of relevance. But I think the point is that it's again about not making assumptions and about using digital when it's the right format for the content that you're delivering and not assuming that it is. And also within digital, choosing whether it should be an email or a text or a website or an app, based on evidence and based on what needs to change, as opposed to making the assumption, because that's kind of the top-down solution. So other questions or comments?
So it's Mauricio from the Bupa UK marketing unit. So in terms of modes of delivery and understanding what sort of propositions serve best to be able to change behaviour, I feel like you kind of need to have the right data infrastructure in place to be able to track the response of audiences that are exposed to those different messages. Considering that our data ecosystem needs some maturing to be able to support that sort of stuff, is there anything in your scope that looks to help us get over the line in that aspect?
So we do have a kind of stream to our work at the moment that is focusing on data integration, trying to pull together data from different sources. And I think it's a really good point. We talk a lot about the need to work based on insights, based on data, based on evidence, but we need to make sure that evidence is reliable. Not sure if you want to speak to that, Fiona.
I mean, before digital, there were interventions in which we measured the reach of them, the engagement of it, but there was a lot of different methods, and those methods were quite time-consuming to be able to understand that. So that's the wonders of digital, is that we're continually learning more and more, so that there's the continuous improvement in any products that we have, and we can know what works and what doesn't work. But I think what's difficult about that is it's often something that we need to build into a product when we build it to start with, when we develop the intervention. So what we're finding now at Bupa is perhaps we're sort of retrospectively looking at data sources that we have and making sense of them, which is a bit more challenging, but is really important for us. And I think that I heard something, I'm sure it was said a lot more eloquently, but apps were the last 5 years, the next 5 years are all going to be about big data. So I think that's something that should be a priority for Bupa, definitely.
And I think it's also getting back to being really clear about what success looks like. So if you're looking to change some kind of broad concept like engagement, being very specific about what that looks like in terms of measurable outcomes, whether it's to do with number of clicks or amount of time spent on something, or whether it's a more subjective experience or kind of a self-reported change. So there's differences between measuring some kind of like proximal outcome, like the extent to which you like something or you feel good about something, which is different to something that's a change in behavior, which is kind of the next step on, which is different again to something that's even further, which is something to do with maybe a health outcome or a cost related outcome or something to do with retention. Those are more distal. So I think it's being clear about what stage you're wanting to focus on, and knowing, I guess, trying to build that in from the outset, like Fiona said.
Great question.
So just to elaborate a little bit further on that as well, something which I quite liked at the start of the presentation was focusing on all the different behaviours and all the different touch points and what people are doing to be able to suggest that there's opportunities for behavioural change. I guess, there's a huge opportunity for us to be able to be a little bit more clearer of exactly what people are doing in what channels, so that we can ideate some of those ideas.
Yeah, definitely.
That's definitely where you start. You've got to start with that data to be able to actually unpack what the behaviour is, because that's it's not, once again, it's not assumption. So using the process, the behaviour change process, isn't about assuming what people's capability, motivations and opportunity are. It's about actually going to sources of data and asking people what actually influences their behaviour. So you're absolutely right.
Yeah, and I think another point which I didn't have time to go into on too much detail is if you get to the second stage, so if you've got a problem statement and then you've managed to generate a long list of 15 behaviours that are relevant to that problem, how do you then go about, if you buy it that it needs to be specific to one behaviour, how do you then go about narrowing it down? And there are criteria for that. There's a kind of number of tools that we use, but it's considering things like impact, kind of cost effectiveness, and also what we call spillover. So behaviour doesn't take place in a vacuum, it takes place in a map of other interconnected behaviours. And some behaviours are more central in that map than others. So there are some behaviours that if you focus on them, they are likely to lead to change in other behaviours. So for example, if you want to change, so say in a weight management intervention, if you generated a long list of behaviours and some of them are to do with physical activity and some of them are to do with diet, how do you know what to focus on? And one thing to consider is that maybe if you focus in on, say, reducing sugary drinks consumption, that will spill over into also reducing fatty foods consumption and also potentially increase in physical activity. So it's about being strategic about the behaviour you choose, and kind of also pragmatic, I guess, in terms of what's going to be acceptable, what's going to be realistic, what's going to have impact. There are criteria you can use to narrow it down if you're kind of struggling at that stage. Any other questions or comments?
Hey, Rachel, it's Brando.
Hi.
Hey, I have a final question.
Mm-hmm.
Do you see any possibility for us within Bupa, as you talked a little bit about earlier in relation to the capability for behavioral science, do you see us being able to potentially kind of build that capability out more in terms of like a knowledge base to then kind of link it back to the wheel and say, okay, so in this particular region or in this particular demographic, we know that we have these kind of customer types or consumer types, and these are the types of problems that they have. And these are some of the learnings that we've had, to a point where we're almost kind of starting to build that big data view across the group, in a very simple way. Is that something that you see us being able to potentially do, I guess?
Yeah. So I think one of the kind of a key focus for us is to be building, like you said, capability within teams across Bupa. So this is not something that's specific to health. It's not something that's specific to digital. It's very broad, and we've got a range of, as Fiona was mentioning, a range of kind of training options, and we've got a Bupa Learn platform that's about to be launched, that kind of is, the aim is to try and build capability in behavioural science across the business. So our team is there as a kind of central knowledge base, but we are absolutely wanting it to be, I guess, embedded more broadly across Bupa. And we have kind of, I guess, pragmatically that looks different depending on the project and the needs, but it could be just a kind of once-off session like this where you talk through some of the principles. It could be more ongoing. And it could be about, I guess, going back to look at some of the models that have worked elsewhere. So whether that's in the empirical literature or based on other experiences. Yeah, I think it's about us kind of bringing the broad principles, but then being applied locally in a context-specific way based on people's individual expertise, because we've got the kind of knowledge in behavioural science, but everyone's working with different populations, with different behaviours, different interventions, different digital products. And so we're absolutely not experts in all of that. So it's about trying to bring the broad principles and then have them applied locally by people who are kind of have the knowledge in behavioural science generally.
And you often say as well that something's better than nothing. So if we do have the expertise here that we can sort of help different teams within the business, but also sort of taking those small steps towards a behavioural approach is better than nothing at all.
Yeah, I totally agree. And I guess the reason for my question is because we've been doing a lot of work around like reusability, right? Like reusability, kind of repeatability, looking for areas where we can repeat things or just reuse things, even if it's kind of from a reference standpoint. So I guess I was kind of wondering if you guys see the possibility for us getting to a place where people can actually go to and say, okay, you know, here are some learnings from a behavioral science perspective, behavioral change perspective. Here's the data behind that. Because I heard the term big data used a few times on the call. And so I guess it's kind of like, do you guys see that as an opportunity to maybe move in a direction where we can have that repository for reference from the appropriate people in the market units?
Yeah, potentially. I think it's coming back to the point that a couple of us mentioned earlier about this not just being, it's definitely not about reinventing the wheel, starting everything from scratch, having to do this at every stage. It's about bringing it in at strategic points. And I think it is beneficial for development, but also for evaluation. And a lot of the work that we've done and a lot of the work that I've done within and outside of Bupa has been analysing something that's already been rolled out to see what's worked well, what's not worked well through a kind of behavioural lens. And the learning from that can be, here's what to do next time, but also here's the kind of data we need to be able to answer this question in a more efficient way. So yeah, I can totally see the potential in that.
And as with all things, I think it's also about learning from others what has gone well, but also learning what hasn't worked. I know that absolutely that our team in the last sort of year has really learnt about, what does work and what doesn't work at Bupa around behavioural science. And if we keep sort of learning on top of that, and then the community of practice that I also mentioned as well, that's an opportunity for those sort of people that are more heavily involved in behaviour change, that are applying it to their work, to sort of come together and to have those open conversations.
Does that answer your question, Brando?
Yes, for sure. Yeah, that was great. Thank you.
Okay.
Great.
So I guess just to wrap up by saying we had our email addresses up earlier on. Very happy to take emails, can send on additional information. And yeah, I think these kinds of sessions are really useful to, I guess, kind of talk about what we do, but also hear from people how you think it will be useful and could be applied across Bupa. So we're really kind of keen to connect with people and hear from people about that. All right, so thanks so much for joining the call today, everyone. I guess we'll wrap up with that. And yeah, like I said, happy to take questions by email. So thanks very much.
Thanks, Rachel. Thanks, Juliet. Thanks, everyone.
Paul.
No, it's not bad, is it?